I appreciate that many of you have brought up some of the different myths that have really percolated in this debate. And I'm going to actually read some text from HHS's news release after the supposed compromise, and then ask you to kind of comment on it based on what you've talked about. So this is from their press release. Scientists have abundant evidence that birth control has significant health benefits for women and their families. It is documented to significantly reduce health costs, and it is the most commonly taken drug in America by young and middle-aged women. This rule will provide women with greater access to contraception by requiring coverage and by prohibiting cost sharing. So, Marie and Gloria, since you both brought up some of the myths about contraception actually being good for women's health, I'm wondering if you can elaborate on that just a little bit more. And then Carrie and Monse, if you can maybe talk about what could be the motivation behind HHS basically distorting scientific evidence when talking about promoting and selling this mandate.
Well, I'll start because I'm the gynecologist here and we seem to be the ones under attack. I find it interesting that when you read the goals of this mandate, the first thing you said was to control cost. And I find that a terrible reason to list as first when you're talking about something so important as contraception and versus natural fertility. I have a sneaking suspicion that a lot of this Obamacare outline is based on cost. It's not based on human healing or human wellness. Birth control pills, in some instances, can be helpful to treat medical conditions, but that's for a system that's broken. I referred to a healthy system, and in most cases, when women are on contraception, they're doing it because they are healthy. They're doing it because they are healthy and have fertility. They're trying to break the fertility part of health. They want to make themselves infertile. That said, when I look at the real cost of contraception, it has more to do with women breaking their own hearts, with them, as you said, they are taking the sexual identity out of their life. They are becoming just sort of null and void. They're neutral. Whereas the gift of womanhood is so much more than that. It's spiritual, it's love, it's emotional, it's so many things. And when you break that, when you break the fertility cycle in a woman's body, that breaks her body, soul, and spirit. And when we look at the whole person, we realize that she's no longer healthy. She has taken a medication that has taken away her total body's health. And we don't see those costs immediately. We see them later when there may be a problem with depression or alcoholism, anxiety, whatever. And, really, we cause that ourselves in her and don't even realize it. So how can you measure the bigger picture here when you talk about women's health? It makes me hurt sometimes.
I'd say, oh yeah, it's good for women's health. Let's look at all those big warnings when you have these contraceptions. They're like pages telling you what might happen wrong if you take this, and that's good for my health. I remember having a discussion about contraception with women who don't think like me, and for religious reasons. And one woman said, I just don't like the idea of taking a pill that's fooling my body into thinking it's pregnant when it's not. She says, how can that be good for me? And I said, you're sure right. You're sure right. You're sure right. So from experience of these medications that it's not true that it's a wonderful health aid to women. We know that there are many, many risks involved with contraception. And this whole idea of reducing health costs, the thing that bothers me about that is it sort of puts on the woman, it's your duty to be fiscally responsible by not having children. And it also sets up the child as the enemy of women and men, right? And then there's this whole concept then of no longer of sex being holy, sacred, wonderful, procreative, something that, is intimate and beautiful. Sex then becomes something you have to protect yourself from, because you also have to use protection when you're having sex. And where do you need protection? You need protection during acts of war. And I certainly don't think that what I do with my husband is an act of war. And I should hope that we realize that when they talk in these terms, that's what it's setting up in our minds, right? And these attitudes and perceptions are being also held by our youth. And also very much if you look at some radical women's groups in their thoughts, like I said earlier, forced pregnancy, the unborn child is a parasite on the woman, that even to go so far as to disavow breastfeeding because it's unfair to the women, because it's something that a man can't do, so we should stop breastfeeding altogether. I mean, these are legitimate thoughts and ideas that people are having as a result of, no one really challenging the canard that these things are good for us when they really aren't. And we know as Catholics, nothing that is set up against us as God made us is ever going to be good for us. We know that as Catholics, and we know that the objective truth through science and whatever is going to bear out these facts. And so we should be very comfortable in talking about these things with people, especially when they don't agree with us.